My name is Karen Liao. I'm the Associate Program Director of the Family Medicine Residency Program at UIC Rockford. I am also the Faculty Advisor of the Stretch OB program. Practicing in Rockford, we really do see the impact of lacking maternity care in rural and underserved areas. Shortage of the provider practicing in a rural area is also one of the many reasons causing a maternity care desert.
I'm Dr. Beth Schleicher, an obstetrician and the project director for the Stretch OB program. Stretch OB is an acronym for Structured Training for Rural Enhancement of Community Health in Obstetrics. The Stretch OB program is a specialty track that began in 2021, and it exists within the University of Illinois College of Medicine Rockford Family Medicine Residency. Residents participating in the Stretch OB track complete all of the requirements for board certification in family medicine, as well as an additional obstetrics and gynecology rotations in order to enhance both their obstetrical skills and their care of women. Our program is robust, with a large patient volume and more than 15 committed preceptors, including obstetricians, FMOBs, and midwives at UW Health Swedish American Hospital, as well as at 6 rural sites, also with dedicated OB and FMOB preceptors.
We have partnered with rural sites that allow us to rotate in surgical obstetrics throughout our 2nd and 3rd years.
For Residence and Stretch program, the curriculum is designed to make them feel comfortable in managing normal and high-risk pregnancies, as well as gain surgical skills in performing C-sections and managing complication of the surgery after 3 years residency training.
Residents participating in the Stretch track have a longitudinal experience on labor and delivery floor, participating in the care of laboring patients, as well as surgical OB. We will have additional assigned shifts on labor and delivery, which allows us more time there in addition to the already scheduled blocks.
The expectation for vaginal deliveries is 100 or more, and for surgical deliveries as a primary surgeon is 50. Both of us have exceeded those numbers. We also have had great rural experience with several choices for our core rural sites.
I will be starting as FPOB faculty with Family Medicine Residency, where I'll be the director of the OB rotations and curriculum, and I will also be the first family medicine physician privileged at that hospital to perform C-sections.
I'll be starting as a full spectrum family medicine physician in rural Canada. In addition to that, I'll be on staff as an FPOB at a critical access hospital, as well as traveling up to remote, underserved communities to provide women's health and maternity care.
Stretch OB residents will have longitudinal OB training throughout their residency at our main rotation sites, UW Health Swedish American Hospital. Stretch OB residents also required to do a 2 to 3 1-month core rural rotations at our affiliated rural hospitals and critical access hospitals. The core rotation helped them to gain understanding of rural practice and visualize their future practice model. It is also a recruitment opportunity for rural hospital and the residents. I absolutely enjoy the connection I make with patients and the sweet and heart moments they share with me. It is the most rewarding and heartwarming feelings. I also love mentoring medical students and residents and see them fall in love within the specialties and see the potentials they have as future providers. If you want to be a well-rounded doctor providing full scope practice and delivering babies, if you are looking for outstanding unopposed family medicine training with a strong obstetric and surgical obstetric training and passionate faculties, in an underserved area, UIC Rockford Stretch OB track is the right place for you.